The Paediatric Speech and Language Therapy service within BANES offers a coordinated and comprehensive service for all children aged from birth up to 19 with speech, language and communication needs. Patient care is at the heart of our service, and we try very hard to create effective and efficient services to a high quality standard. We're a team of experienced speech and language therapists and assistants who work very closely with children, their parents and families, and other professionals involved. We offer services in hospitals and health clinics, and also like to see children in their own environment in the community. So we see children in preschool settings, schools, mainstream schools, both primary and secondary, special schools, and sometimes even see children in their own homes.
I don't know what that is. Oh yeah, it's a camera.
Smooth talking, it is.
Well, since we've been coming here, we've noticed a significant improvement in Matty's smooth talking, to the point where some days you would be hard pressed to notice that he stuttered at all. We've just had feedback from the school who have said they've noticed he's really got a lot better at talking. His jumpy talking has virtually disappeared. So we're seeing effects not only at home, where he's a lot more confident, we're seeing school reports saying he's becoming a lot more confident, more willing to join in, and I think it has made him a lot happier, both at home and at school.
I feel really nice now as I mostly smooth, less bumpy, and I really want to be bumpy, and I mean smooth, every single day, and like my friends do always.
I find it incredibly rewarding to work so closely with families and offer them all the help and support that they so desperately need. We offer a wide range of therapy programmes. The parents are always actively involved, and this helps them to provide the help and support that their child needs at home.
Speech and language therapists don't work in isolation. We work very closely with our colleagues in health, education and social care.
My job is to work with children who've got multiple and complex needs. I work with children from birth to about 5 or 6, and my speciality is children with eating and drinking problems. It's very important in my area of work that we work as part of a multidisciplinary team. I work with physios, occupational therapists, dietitians, paediatricians. We assess children together, and then we write multidisciplinary report and we set aims together as a team, and then we have specialist therapy support workers who will carry out and work with the children on a weekly basis, carrying out our aims. So working as a team is crucial to my job.
Much of our service is commissioned by the NHS, but we also have independent contracts set up with other agencies, including the local authority and individual schools.
The Speech and Language Inclusion Partnership, or SLIP, is an innovative way of bringing speech and language therapy into the heart of primary schools and secondary schools. A few years ago when we started, we asked the schools what they wanted, and they told us they wanted to have their own speech and language therapist working in the school with the children and their staff. The service is partly funded by the NHS, but the majority of it is a traded service and the schools buy us in. They also have access to specialist speech and language therapy consultants in areas such as autistic spectrum disorder or multiple and complex needs. We also have a specialist language teacher working within the team, and she's available to come and work in the schools as and when requested and needed.
The speech and language therapy service we have here is absolutely invaluable. In fact, I'm not really sure. Well, I know we could not be effective without it, because we have 1 day a week. Our therapist comes in, she's got the most phenomenal ideas, and the main thing is it works. So we see a benefit in the children all the time, and it makes our work easier because we've got bases to work on.
We have an open referral system, which means that parents and other professionals can refer directly to our service. We also have a telephone advice line which enables parents or other professionals to speak directly to a speech and language therapist. Following referral, a child will be seen for assessment where their needs are identified. We not only work with children who've got speech difficulties, which is what the majority of people think we do, but we also work with a huge variety of children with communication difficulties. For example, we see children with feeding and swallowing problems, comprehension and expressive language difficulties, poor social communication, stammering, voice disorders, hearing loss, and those with learning difficulties, emotional and behavioural difficulties, and physical difficulties. As speech and language therapists, we believe that all children have the right to be helped with communication skills so that they can develop an independent voice and reach their full potential. There are also many benefits of being part of a bigger organisation, such as access to regular clinical supervision, up-to-date training for staff, and robust monitoring of standards and quality. I think we have an outstanding speech and language therapy service within BANES. The staff are dedicated to their profession and work very hard to ensure quality, evidence-based services that provide excellent value for money for the commissioners and the best possible care for the children we work with.